Hi everyone. At Smile to Dental Boutique, we treat a lot of kids or children ranging right from the age of 1 year to about 15, 16 years of age. They all come with different forms of problems. Most likely it is issues with cavities and teeth, and sometimes even with issues of jaw growth. So parents, when they come, they don't realize that a regular checkup for a child is extremely important. So the question that is normally asked to me is that what is the right age to start a checkup for kids? Well, the child should visit the dentist on the first birthday, that is as soon as the child turns 1, or when the first tooth is seen in the mouth. How often should we visit the dentist for a dental checkup for our kids? Well, the right time is every 6 months. Yes, you need to visit the dentist for your child every 6 months. Growth spurts are happening in children, and sometimes within these 6 months we see multiple changes happening in the teeth and in the mouth. Hence, a 6-monthly checkup is very important. So, the question always comes is that, why do cavities form in the kids? Well, cavities in teeth can be because of multiple reasons. Most of the times we have seen diet is the biggest factor over here. So, you have to avoid frequent snacking. Once the child turns 2, you can always keep a gap of about 2 hours between meals. By the time the child learns to rinse or develops that reflex of rinsing, always make the child drink water after every meal. Obviously, avoid junk foods like biscuits, pizzas, burgers, chocolates. These are all fizzy drinks. These are all culprits in the diet these days. Then the question comes in is, okay, it is just milk teeth. Why should we even bother? They are going to fall off. New teeth are going to come. Well, the milk teeth are equally important. Nature has given us something for a reason, and we need to maintain it in a healthy state. The milk teeth are going to help in speech, in chewing food properly, in the growth of the jaws, and also to guide the permanent teeth which are coming in the right place. So, how do we prevent the cavities in teeth? Well, make sure the diet is correct. Ensure that your child is not sleeping while having milk at night. This is another common reason for cavities to develop, usually in the kids before the age of 2 years. The typical habit is putting sugar in the milk and allowing them to sleep while they are having milk. Well, this habit needs to be changed. A lot of children also develop thumb sucking or digit sucking habits, which need to be corrected post the age of about 3 to 4. Otherwise, they also bring about difficulties and changes in the jaw growth. There are other ways of preventing cavities also, which is by fluoride applications or by applying sealants onto the teeth. Well, these are certain treatments that can be done by the dentist, and you can connect with your dentist to help you explain about these things. The other question that also comes in is that there are certain teeth which come in the mouth behind all the baby teeth, and we don't realize that. These are the molars which come out at the age of 6. These are permanent molars, and they come very, very silently. These molars are the most common to get infected with cavities or decay. So, a regular checkup once in 6 months is mandatory for all the kids. And this will help not only in preventing the cavities but also in taking care of the jaw growth. One most common question that comes to us is that, how do I handle the fear of the dentist? Well, the first and the foremost thing is for you parents, please do not pass on your fears to the child. If you are scared of the dentist, that does not mean your child also has to be scared of the dentist. At Smileco, whenever a child walks in, we provide an environment which is child friendly so that the child feels extremely comfortable. The child is always rewarded for their good behavior. We sometimes put cartoons on the screen so that the child can watch them when they are doing treatments. All the dental treatments are extremely safe, including local anesthesias. We also treat the child sometimes under sedation, that is nitrous oxide or happy gas, if the child is not cooperative. So so it doesn't mean that your child cannot undergo dental treatment or can't have healthy teeth. Please do connect with us as to how we treat kids at Smileco, and you will be happy to hear from us. This is Dr. Darshika Gadakelkar from Smileco Dental Boutique signing off. See you soon.